I'm Manpreet. How are you?
I'm fine.
I'm your nurse today. I'm gonna do head to toe assessment on you. Are you okay with it?
Yeah, I'm okay.
Hand washing done. Maintaining the privacy. Can you please show me your ID?
Yes.
Yes, your your ID matches with my hospital records. Are you okay with it? Can I start?
Yeah.
Okay.
Sure.
Actually, doctor ordered me to do the head to toe assessment on you to collect the baseline data. So that's why I need to do the assessment.
Okay.
So for this, I need to know about your pain. So do you have any pain anywhere?
Yes.
Where?
Headache.
Okay. What makes your pain feel better?
The rest.
Okay. And can you please describe your pain for me?
Yes.
Just let me know that is it dull pain, sharp pain?
It's dull.
Okay. And is it radiating somewhere?
No.
Okay. And what's the severity of pain? Like if I tell you to give one number, like from 0 to 10. 0 is minimum, 10 is maximum. How can you rate?
So it's 2.
Okay.
Yeah.
And what time did your pain starts?
Usually in the evening.
Okay. And what can you understand from your pain? Like I can say that why you feel pain? Why you have pain?
Workload and stress.
Okay.
Yes.
So it's all about the assessment of pain through PQRSTU. My patient has a dull pain. She has a headache. She gave me number 2. So I documented the pain assessment. So next come to the neurological assessment. So I'm going to check the conscious level. What's your name?
Jagjit Kaur.
What's your mother name?
Paramjit Kaur.
And where are you now?
In the hospital.
And what's the time now? Like morning, evening, what?
In the morning.
Okay.
Yes.
So my patient is conscious and alert. She is oriented to time, place and person. Now I'm going to do the eye assessment. So I'm gonna flash the light into your eyes to check the pupillary reaction. Just open your eyes. I just need to check the pupillary reaction. Okay. So pupils are reactive to light. Now I'm gonna do the accommodation. Just focus on my nose tip and just move your eyes towards this object and don't move your head. Just move your eyes towards the object. Focus on your own nose tip and move the eyes towards this object. Okay. And just now again, don't move the head. Move eyes towards this. Superior, lateral, inferior. Okay. So close one eye like that. Okay. And just let me know the numbers.
2, 4, 2.
Superior,
2,
lateral,
4,
inferior. And close the other eye.
2, 4, 2.
Superior,
2,
lateral,
4,
inferior.
2.
Okay. So this is all about the accommodation and confrontation, which is normal in functioning in my patient. So according to Parla, the pupils are equal, round and reactive to light and accommodation. Now I'm going to assess the cranial nerves. So can you please raise your eyebrows for me and move your eyes laterally. Okay. And move your don't move your head, only your eyes, and move your eyes downwards toward your nose. Okay. And smile. Show me your tongue. You feel sensation?
Yes.
Okay. Make your face angry, puffy. Okay. So I assess the cranial nerves. Third is oculomotor, fourth is trochlear, and sixth is abducens. These are the cranial nerves which are responsible for eye movements and to see the objects in motion, to see objects laterally, and to see the downwards, which are normally functioning in my patient. And facial nerve is also functional, which is responsible for giving the facial expressions and gestures. It's also normally functioning in my patient. So this is all about the eye assessment. And so I covered all parts of neurological assessment and documentation done. Next come to the respiratory assessment. So can I start?
Yes.
Okay. So just sit straight and inhale and exhale. Okay. So on inspection I found that patient chest is bilaterally symmetrical, and it's symmetrical in nature, and there is no barrel shaped chest, no pigeon shaped chest, no inversion and bulging I found. So now I'm gonna auscultate the points. Inhale and exhale. Yes. Okay, just move backward. So I also need to check the lung expansion. So just inhale and exhale. Okay, so the lung expansion is normal bilaterally. Now I'm going to assess the posterior points. Inhale and exhale. Okay, move forward. So on auscultation I found anteriorly and posteriorly there are normal lung sounds heard, breath sounds are normal, the rhythm is normal, it's non-labored. There are no adventitious sounds found like wheezing, strident and crackles. The lung sounds are vascular, bronchial and bronchovascular, and the rhythm is regular and it's non-labored. So I'm gonna start your cardiac assessment. Are you okay?
Yeah.
So
Okay.
after documentation of respiratory assessment, so next move to the cardiac assessment. So can you please lift your breast up so that I can hear the apical pulse? Yes, lift. Okay, so the apical pulse is 72 beats per minute. It's normal, rhythm is also normal, and on auscultation I heard the normal sounds. There are no murmur sound. On Erb's point, on aortic, first one is aortic wall, I heard the S2 sound which is present on the right sternum border on second intercostal space, and on pulmonic wall I also heard the S2 sound which is present on the second intercostal space on left sternum border, and the third is Erb's point which is present on the third intercostal space on left sternum border, and I heard the S1 and S2 sounds which is loved up, and the fourth is tricuspid where I heard the S1 sound, and it's present on the fourth intercostal space left sternum border, and the last is mitral valve where I heard the apical pulse, and it's present on the midclavicular line on left side, and there is no murmur sound found. S2 sound, S1 sound, S2 sound found here. So on cardiac assessment I explained that I heard the normal sounds, no murmurs. So documentation done on cardiac assessment. So can you please lie down for me? I'm gonna start abdominal assessment now. So firstly I'm gonna inspect the abdomen. So there are no so before inspection I'm gonna ask question. So what's the last bowel movement? When is your last bowel movement?
The last night,
Okay, and when is your when you void last time?
2 hours before.
Okay, and can you also tell me when is your last periods?
It's 2 weeks ago.
Okay, so on and on inspection I found that there is no abdominal distension and there is no lumps, and there is no like masses found. The skin is also normal, there is no bruises. And now I'm gonna check the counter. I have to raise the bed on my abdominal level. So the counter is flat, the abdomen looks symmetrical. So next is the auscultation. I'm gonna auscultate the vowel sounds. So first is the right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. So the abdominal sounds are the vowel sounds are normal on abdomen. So if I don't hear the vowel sounds, I have to wait 5 minutes to restart it. So now I'm going to palpate your abdomen. If you feel any pain, just let me know.
Okay.
So just let me know if you feel any pain, okay?
Okay.
Right upper quadrant, right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. Do you feel any pain?
No.
Okay, so on palpation, patient feels no pain, there is no tenderness, there is no lumps found. So it's all about the abdomen. I explained about the inspection results, findings, and auscultation and palpation. So can you please again sit, because I have to do the musculoskeletal assessment also. So are you okay?
Yeah, I'm okay.
Okay, so can you please show me your arm, upper extremities? So do you feel any pain here?
No.
Okay, and the skin is also also looks normal. There is no edema, and there is no deformity, and the bony prominences, there is no bony prominences, there is no bruises. So I also need to check the capillary refill, which is the normal capillary refill is less than 3 seconds. So it's normal in my patient. So patient capillary refill is normal, and the skin of the nails is also pink, and the consistency of the nails is also transparent and shiny, and on the lower extremities also. If you feel any pain,
No.
okay, can you lift it?
Yes.
Okay, so there is no deformity on the bony prominences. There is no bruises, no deformity, no pain, and there is no edema on the lower extremities also. And so next, this is all about the inspection of musculoskeleton, and now it's come to palpate. So you feel any sensation? You feel any sensation?
Yes.
Okay, the skin also warm. There is no numbness here. The circulation is normal, and can you please lift? Okay. Sensation? Okay.
Yes.
The skin integrity is also intact, and the turgor is non-tinting. Skin is hydrated. Skin integrity is intact and non-tinting. Turgor. So can you please do the opposite? Move.
Your side?
Yes, my side. Okay. My side. Okay. Grasp. Okay. So the strength of upper extremity is 5 by 5. Move upward, back, downward. 4 to my side. Your side, backward. Okay. So the strength is 5 by 5. Lower extremities also. So now it's turn to do the pulses assessment. Pulse. So it's carotid. Can you please lift your? Yes.
Yeah, sure.
Yes. Brachial, radial, popliteal, yes. Dorsipedus, posterior tibial, and dorsipedus. So can you please lie down? And last one is femoral pulse. So that's all about the musculoskeleton assessment. So documentation done. Pulses are normal, rhythm is also normal. So that's all about the musculoskeleton function. So thank you so much.
Thank you. Thank you
And
so
documentation done. hand hygiene,